Hi guys, welcome back to Pat Demystified. So today's short tutorial is going to be about CSF, that is cerebrospinal fluid. I'm Dr. Shubhika Sachdeva and let's just dive into the topic. We are going to read about this topic under the following headings. First will be the brief introduction about CSF, then how it is formed, where it is formed and how does it circulates inside your brain and spinal cord, then what are the functions of CSF, then how do you collect CSF and what is the order of collection and what are the tests you perform in those tubes. Then finally we are going to conclude this topic by complications and contraindications of lumbar puncture. So, what is CSF? So, CSF is basically an ultrafiltrate of plasma. It is a colorless and a clear fluid which is formed by the ventricles of your brain in the choroid plexus. Now, what is choroid plexus? Choroid plexus is a meshwork of tiny small blood vessels in the lateral, third, and the fourth ventricle which forms the CSF. It is produced at a rate of 500 ml per day and it is located in the cerebral ventricles, your spinal canal, and the subarachnoid space. Now, let us see that where the CSF is formed and how does it flow inside our brain. So, CSF is formed in the choroid plexus of the lateral ventricles. From here, it will flow to the third ventricles via foramen of Monro. So this is your third ventricle and via foramen of Monro, it will flow into the third ventricles. From the third ventricles, this CSF will now flow into the fourth ventricle via aqueduct of Sylvius, and from the fourth ventricle finally from via foramen of Luschka and foramen of Magendie, the CSF is flow upwards into the subarachnoid space, into the cerebral hemispheres and downwards into the subarachnoid space of the spinal cord. Finally, it gets absorbed into the dural venous sinuses by arachnoid villi. So, what is the composition of normal CSF? As we read earlier, normal CSF is clear or colorless fluid which should contain no clots. The opening pressure can vary between 160 to 180 mm of water. The total volume is 100 to 150 ml and it can vary between 10 to 60 ml in newborns. A normal CSF should not contain more than 5 WBCs in an adult and more than 30 WBCs in infants. The protein concentration of normal CSF is 1% of plasma proteins, whereas glucose concentration is 60% or two-thirds of the blood glucose levels. There should be no RBCs or blood in normal CSF. So now, what are the function of CSF? Why this is present inside our brain? So it acts as a shock absorber for the brain. It provides physical protection to the brain and the spinal cord from any injury. Then it serves as a medium between blood and brain for supplying of nutrients and removal of waste products from the brain. And finally, CSF provides a suitable chemical environment for neuronal signaling. That is, it maintains a balance of ions to facilitate action potentials inside the brain. So now let us see that how do we collect CSF. CSF is most commonly collected from the subarachnoid space in between L3 and L4 or L4 and L5 vertebra. The ideal space of collecting CSF is the conus medullaris between L4 and L5 vertebra in adults. So let us see what all layers do we need to puncture before reaching the subarachnoid space in between L3 and L4 or L4 and L5. So the first layer that you would puncture is skin and fascia, followed by the intraspinous and the supraspinous ligament right here. Then you would puncture the ligamentum flavum and reach the epidural space. After reaching the epidural space, we'll puncture the dura and the arachnoid matter and finally reach the subarachnoid space in between L3 and L4 or L4 and L5 vertebra and collect CSF from this space. So the process of collecting CSF is called as a lumbar puncture and the needle that we use for it is called as the LP needle or the lumbar puncture needle. This right here is a lumbar puncture needle which will have a needle and a stellate. The most common size that we use is in between 20 gauze to 22 gauze, out of which the 22 gauze is the most commonest one for an adult. Now, in which position you will put the patient in order to collect CSF? So, the most common position is a side lying position in which the back is absolutely straight, the knees are drawn up towards the abdomen, and the head is flexed onto the chest. Why do we choose this position? It increases the space between the lumbar vertebra, that is L3 or L4 or L4 or L5 vertebra, where we will do the procedure. It will increase that space. The other most common position is, alternatively, we can use a sitting position. So now what do we do? Firstly, we will clean the area, the selected site, with providone iodine or chlorhexidine containing solution, and we'll put sterile drapes all over the area, just exposing the site that we have to do the procedure on. After that, we'll give 3 to 5 ml of 1% lignocaine as a local anesthetic to the patient, and very slowly we will pass the needle straight into the L3 or L4 or L4 or L5 vertebra. As you reach the subarachnoid space, there will be a sudden give away or loss of resistance that you will feel. And as soon as you feel that loss of resistance, you slowly take out the stellate from the needle and put your test tube just beneath the needle in order to collect CSF. So now, once we have actually reached the subarachnoid space, we would collect at least 3 to 5 ml of CSF. So what would be the order of collection? The first test tube you will collect 1 ml of CSF, and you will subject that 1 ml of CSF for chemistry, that is glucose or protein or serological examination. In the second test tube, we'll collect 2 ml of CSF and we'll subject that CSF for microbiological examinations such as gram stains, AFB, India ink, bacterial culture or fungal culture. Then in the third tube, we'll collect 1 ml of CSF and we'll subject this sample for hematological examination, that is the total leukocyte count and differential count. Also, in this tube, physical examination is best done. And lastly, in the fourth tube, we'll again collect 1 ml of sample and subject that CSF for cytological studies and any other special studies such as immunology or any other additional test if it's required. The indications of CSF collection. So CSF collection is an invasive procedure. The patient is undergoing a lot of pain. So there has to be some important indications for us to do this procedure. So first is CSF examination helps in diagnosis in suspected cases of CNS infections, especially meningitis or encephalitis. Then it also tells about meningeal involvement in case of leukemia or malignancy. It can give us a hint about subarachnoid hemorrhage and other inflammatory diseases such as multiple sclerosis or Guillain-Barré syndrome. Medications will include to reduce the CSF pressure in case of benign intracranial hypertension. We can also administer some special medicines through CSF route such as anesthetics drugs or antibiotics or anti-cancer drugs. And lastly, introduction of radiographic contrast media for myelography, we can use CSF route. Every procedure comes with its own set of complications. So what are the complications we face with lumbar puncture? The first one and the most common is a post-puncture headache. Why does it happen? It happens because there is a leak of CSF from the puncture site, which is at a rate faster than the rate of CSF production. And why would it happen? In case we have used a very large bone needle, there will be a greater CSF leak leading to a post-puncture headache. So how would we prevent it? We would prevent it by using a smaller gauze needle. As I told you, the most common size for a LP needle for adult is a 22 gauge needle is the most appropriate size. The second complication is infection in the spinal canal. Now, why would this happen? This happen because if we don't take all the required aseptic precautions before doing an invasive procedure. So other less common complications include a subdural hematoma, which can also result in a neurological deficit in patients with bleeding diastasis. Then there can also be a dry tap. What do you mean by a dry tap? A dry tap means failure to obtain CSF, which may be due to an incorrect positioning of the patient or because of a spinal block. And finally, most rare one is herniation of brain through the tentorium or foramen magnum, and this occurs in case we are doing a CSF procedure where the patient already has a high intracranial pressure. In some cases, we can also see a subarachnoidal epidermal cyst. This can happen because of traumatic implantation of the skin plug into the subarachnoid space, and it may develop even few years after we have done a lumbar puncture procedure, especially if you have done it without the steel plate. Now, what are the contraindications for lumbar puncture? First of all, raised intracranial pressure. Like I told you that in case we do a CSF examination in raised intracranial pressure, it can even lead to herniation of the brain. So why would a patient have a raised intracranial pressure? It could be because of a space occupying lesion such as brain abscess, posterior fossa tumor or epidural abscess. So what are the signs in patient that you will see to recognize and raised intracranial pressure? These patients will present you with headache, altered pupillary response, absent Doll's eye reflex, papilledema, bradycardia, hypertension, and even decerebrate or decorticate posturing. So in all these signs, if you're seeing in a patient, that means he might have a raised intracranial pressure, and we should not do a lumbar puncture examination for such a patient. The second contraindication is a cardiorespiratory compromise, bleeding diastasis, and local infection at the site of lumbar puncture is also a contraindication. So that was a short tutorial about the CSF examination. How would a normal CSF look? What is the appearance? How would you collect CSF for CSF examination? What are the indications, complications, and contraindications? So that's it for today. I'll see you next time with more exciting stuff. Bye, and do not forget to like, share, and subscribe.